So the CASIEF model works really well because it is simple and sustainable. And rather than focusing on service delivery, its mission is really to train people who can become future leaders in anesthesia. And, I've witnessed with my own eyes how very powerful that is, that by accompanying people, by being there to help them and to give them confidence and skills, you see them blossom as leaders, and that is incredibly rewarding. Both Francoise and Gaston are excellent examples of people who have been through the CASIEF program. They started as first-year residents, and now they've achieved so much excellence. Francoise went on to become the program director of anesthesia residency, and Gaston went on to start a pain management program in Butare. And both are leaders who've published research and are highly involved in teaching and administration. So they're examples of people who have been huge beneficiaries of the CASIEF program. And, I know personally that both of them are also very involved in teaching the non-physician anesthetists who are the main providers of anesthesia around Rwanda. So I'd say those are two very huge success stories. So prior to Gaston implementing the pain service in Butare, many patients were not having pain adequately treated at all. I actually went around to some of the wards, and people would be sitting there very stoically suffering, but they wouldn't be saying anything. They wouldn't be reporting their pain. And you could tell they were in pain. And when actually you probed to ask, they admitted it. And a lot of, so the patients were suffering, and there were many barriers. Many of the hospital personnel were reluctant to provide medication for various reasons. Opioid phobia was very common. And we know that opioids aren't the solution to everything, but certainly when patients have severe cancer pain or acute pain, it's really dreadful if they're not treated. I saw one young teenage girl who was treated she had cervical cancer that was metastatic, and she was only receiving paracetamol, which is completely inadequate for treatment of pain. So Gaston was able to initiate a pain service with a team of nurses and non-physician anesthetists who went around and educated the hospital personnel and implemented protocols to ensure that patients were at least receiving essential pain management. We also ran the essential pain management course in Rwanda, and that's made a big difference as well to really uniting teams with a common vision. It's really important to have a connection to a place and to go back time and time again, because if you're only there once, people just get to know you. But when you go back again and again, it shows that you're serious, and you start building up relationships. And once there's friendship and trust, there's really no limit to what you can accomplish together. People feel it takes time to build these relationships, but then people become, they feel comfortable asking for things. They feel comfortable writing with questions even when you're not there. You work together to solve problems. These are very, very important things that don't come from a short visit. The money donated to CASIEF goes really far. I'm convinced that CASIEF is run on basically a shoestring budget, and what we accomplish for the money we spend is amazing. Just, having a few volunteers in Rwanda and bringing some residents, it's relatively low cost. And when you see the impact, it's quite monumental, the impact to training, to see how the education system can be so improved by that. There's really no waste that I've been able to identify. The money is spent very, very wisely. But why do it? Well, I think that goes back to another question that you didn't specifically ask me, but I think it's really important to identify that participating in CASIEF as a volunteer is so rewarding. I had a lot of doubts before I went my first time, but what I got was so much. I learned so much about the world and the reality of anesthesia, which is very different around the world than it is in our very isolated community in a high-income country, how anesthesia is practiced and how resourceful people are, that really opens your eyes to a much bigger picture, which I think is a very important reason to participate as a volunteer. But there are many people who can't participate as volunteers for lots of reasons. And if they are able to provide financial support, that makes a world of difference to the quality of care elsewhere.